You may know her from her. Oh,
Sorry, keep going.
no worries. So good morning. I just wanted to introduce myself. Again, my name is Amelia Barilli Simon from Public Health Services with the County of San Diego. And I'll provide a brief introduction on the CDC COVID-19 health disparities funding. And I wanted to just also give a shout out to my team. Spencer Stein, you'll be hearing from him a little later on about one of the county programs available to you. And then Joanne Fields, who's new with the county, and you may know her from a lot of her community work. So just welcome to them. Thank you all for being here today. So go ahead and share. Are the slides shared yet? Okay, there you go. All right, next slide. So some of you may have seen the little small print at the bottom of some of these announcements that this is nationally, this is known as the COVID-19 health disparities among populations at risk and underserved, including racial and ethnic minority populations and rural communities. And San Diego was very honored, the County of San Diego, to receive $24 million. And it's a very short time period, June of 2021 through May of 2023. And really the goal is to look at equity. How can we, California has been responding very well with COVID-19. The last surge was in January, but we just don't know what's going to happen in the future. And we also want to be prepared for other kinds of disasters and emergency preparedness. So that's part of this, and to look at the populations that have been most affected by COVID-19. And so I wanted to make sure everyone gets this PDF so that you can see who the target population is. So African Americans, Latinos, Native Americans, Asian Americans, Pacific Islanders, other people of color, and then this other definition, people most affected by COVID-19, also includes people who live in rural communities, members of religious minorities, LGBTQ+ people, people with disabilities, and people otherwise adversely affected by persistent poverty or inequality, because we know that there are these social determinants of health that make certain populations have challenges because they're not having their various needs met. So that's the purpose of this overall grant. So next slide. Okay, so what is the money being spent for? Because of some of the emergency response, we've shifted a lot of county staff over to COVID and then also hired some new staff. So a total of about 56 full-time equivalents, not exactly 56 people. Some people are doing COVID part-time. So that's a little under $9 million. We were very proud. That's actually one of the requirements of the CDC grant, was at least 50% of this funding needed to go out to contracts. And so we have 56 million, sorry, did I just say 56%, $13.5 million going to contracts. So the bulk of it is going for education and in the community. So we have the San Diego County Office of Ed. We have contractors that do surveys and community education, money for translation services, and just hot off the presses, the county expanded their threshold languages from 5 additional threshold languages to 7 as of July 1st. So I can also send a little blurb about that so that you know that as of July 1st, there will now be translation into 7 languages, including Somali. Oh, I shouldn't have said that off the cuff. Somali, Korean, and Persian, I believe. But don't quote me on that. I will send you the notice. And then about $1 million for PPEs, travel, and other expenses. And then we're very proud of our lower indirect costs. It's 4%, $1 million, out of 24 million. It's so that is what the money is being spent for. And as I highlighted at the bottom, the funding is for 25 contracts out of that 13 million. Next slide. So I'm not going to go over, oh, someone, hang on just a second. I'm trying to read the comments here. Okay. Just wanted to share that this is the general PowerPoint that has been shared with all of our contractors. So we go over all the strategies, but today we're just going to focus on strategy 4. But I wanted to let everyone know what all the strategies for this $25 million is for. So really the first strategy is, how do you prevent and mitigate the COVID-19 disparities? And there's testing, vaccine coordination, and collaboration. Next slide. I'm trying to go through this quickly because we have a full agenda today. And then a lot of funding is for technology to improve data collection and testing vaccines, strategies for education, assessing the prevalence, and really looking at, the complicated data systems around addressing so many unique populations. And then we also have some clinical partnerships. Next slide. So the third strategy is to look at the county as its infrastructure. So how are we coordinating our infrastructure? How are we addressing equity? The Office of Equity and Racial Justice is a big part of this. Live Well San Diego partnerships are also a large component. And then again, language is also very important. We are very proud of our community health worker model in San Diego, and how do you support that as well? And then the county's website needed a lot of work. So there's a funding going to improve the language access and ADA compliance for the website as well. Okay, and then the last strategy is where the chambers fits in. And so it's about mobilizing partners and collaborators, because the county cannot do this on its own. And then the business community plays such an important role in the community. So that is this component, connecting with the business sector. And I think that's really the end of my slides. I just wanted to give you that overview. Again, welcome to everyone for being here, and then I'll turn it over to Stephanie.
Thank you. And thank you, everybody, for being here. A huge thank you to the county leadership and the county HHSA team, Amelia and her folks. I think seeing the breadth of what they have to accomplish, I think we all probably saw there was like the climate action plan was in there, updating the website, which thank you. Right, this is a lot of work, and so I'm really excited that the county stepped up to this moment. So many of us have members or businesses that we're working with who are just really at a loss about how to proceed with COVID, especially during this recovery. And I think that this effort is really wonderful in that it's going to reflect the best practices that we've all found in our members or our partners, and be able to share that information. So I'm going to go ahead and share my piece, which is much less pretty than what Amelia had, so forgive me. But we're just going to kind of get down to the nitty gritty about what it is that we're charged with doing as one of these subcontractors of the county. So the San Diego Regional Chamber of Commerce, we, of course, regional into the binational space. We have a number of members in Cali Baja and representing the workforce and business community there, as well as throughout the county of San Diego. We got started on the Back in Business program back when COVID hit, and our partners, San Diego Regional EDC, the Tourism Authority, University of San Diego, and Deloitte helped us put together this policy document, which is helping to inform the early phases of what we do with this grant. And so I would encourage you guys, I'll send this out, but you can hyperlink. You can just click that and see what some of the takeaways were. There's an economic baseline. We all know now that 90% of businesses at least were impacted adversely by COVID. We also know that certain industries, certain populations were impacted disproportionately, much to what Amelia was just saying. And so the question is, how do we elevate those businesses and those populations that were more disproportionately affected to make sure that recovery is more equitable, right? We all keep saying that this is the new normal. How is the new normal better than the old normal? That's really what we're all committed to kind of seeing. The key, it's like a 20-page report. Read it if you'd like, but the key takeaways that we had, which are not going to be surprising to anybody, but we're going to go through them. Enhancing health, safety, and pandemic preparedness. A lot of what we're going to be doing with the grant with our subcontractors is going to be focused on that. Managing finances and increasing revenue, reskilling our workforce and investing in new capabilities for them and for our businesses in general. Rethinking working parents and caregivers. I think COVID has done a great job of reframing that our employees and our customers are not just that single entity that we deal with. Instead, they are a piece of a component, right? They're a piece or a component of a family, of a household, of a larger neighborhood or community. And so thinking of them that way is going to help us reframe the way we're working with them. Accelerating digital adoption, certainly our tools that are allowing us to do, contactless payment, digitization of our general points of sale and all that, websites, all that stuff would live there, and then redefining the customer experience. And so many of these points feed into one another, right? We all know that our businesses are these living, breathing entities. Our members, our partners, living, breathing entities. And how do we support them post-COVID? And in particular, you all have these stories and experiences where you know that business XYZ was one way in March of 2020. They reimagined themselves in August of 2020. There was another surge, right? And so we're all different iterations of ourselves from when we were, when the pandemic hit, and really approaching that with that flexibility is important for us because we know that everybody's at a different phase of recovery or reimagining what their role is within their community or their economic space, right? So all that, the back in business piece is sort of the philosophy and the guiding principles we're using to determine what the business community probably needs or what would benefit them the most. To that end, as a part of the broader contract with the county, the COVID-19 Health Disparities Project, our goal is to build resilience within the business community focused on those populations that Amelia talked about. And when we talk about those populations, it's both businesses that serve those populations, businesses that employ those populations, businesses that are owned or operated by those populations. So it's a very organic way to think about that role within the community. And many of you work with those particular businesses through a trade group, through a larger coalition, maybe geographically centered. And whatever that is, we welcome that. There's no tight limits here. So moving into this, we have 5 subcontracts available that will focus on one or more of the keys of the following programs or policies: improving access to testing and vaccinations. And we can do that through our existing Time to Vaccinate, which we're translating with the help of the county. So there's a ready-made tool. But if you find that you have better trusted partners that can go into the community and advocate for vaccines or find ways to improve access to boosters or whatever comes next, that's one space. An additional space is reducing barriers to employee health and safety related to COVID-19. That can be a number of things, including, helping folks comply with the emergency temporary standards that come out of Cal OSHA. Those rules are changing as of May 6th. How many very small businesses are aware of that? We can all venture a guess that if you're not connected to a trade group or a larger coalition or advocacy organization, that is news to you about when they have to test, who has to test, and who's paying for those tests. Very important that employers are ready for that, and that they're making sure that their customer base is safe as well. Increasing worker supports, job security, healthcare benefits, and or childcare resources. That's kind of a catch-all bucket about making sure that folks are resilient in their own lives, that they know about best practices and the tools available to them. And then, of course, increasing business and worker access to emergency preparedness resources. like adopting policies that can link their employees or their workforce or their community partners back to ready-made programs that exist within the county, like Ready San Diego or the Alert San Diego app. And we're going to go through 2 of those programs today so you can see what that might look like. And if you think, oh my gosh, this chunk of businesses I work with, this is perfect for them. All we need to do is connect them, have an event, a roundtable, boosting, whatever that is, that's what we want to introduce you to. These contracts will be about $25,000 each, give or take a handful of dollars. But I want to specify we have 5 subcontracts, 5 buckets. That doesn't necessarily mean that if you're thinking I want to do something that's only going to cost $8,000, I shouldn't apply. Do that. We can break these up. We are approaching this with flexibility, knowing that businesses are recovering differently and what we'll need may change. Okay, so this is a wide open game, just like many of our business organizations, our customers know it is, right? So key considerations, you can include any one of those or more. So it could be that you think that vaccinations and emergency preparedness, working with those county programs makes the most sense, and you want to pair those up because you have a really compelling program that would work out there. You have proven history of getting out into the community and doing door-to-door services. You have a subject matter expert that you can leverage within your membership. So it's kind of a mix and match, whatever leverages your experience and who you think you could serve best. It has to include the entire county. So if you only want to work in Supervisorial District 1, unfortunately, that's not going to work. However, even with the folks on this call, I think we're looking at the fact that we can cover the whole county through partnerships. So finding new ways to collaborate with other business organizations or community serving groups, that works. We do want to prioritize folks or places that are identified as disadvantaged based on the Healthy Places Index. There is a typo there, but Healthy Places Index, which is a very easy to use tool you can break down by zip code, and it just cool color coordination about what places are identified as disadvantaged and or opportunity zones. We know that Qualcomm has enough lawyers and enough support on their HR team to get the right resources out to their employees. Do we feel the same way about every small restaurant that is located in the unincorporated areas of the county? We know that they need more support, and that's why we want to target them. You can leverage subject matter experts. You know, if there's a great employment lawyer that you think would be wonderful, if you have a CC&R tool that you want to get out to employers to make sure that they know about childcare resources and that folks that are eligible for subsidized childcare are accessing those slots, great, that works. Flexibility is intentional. It's not that we're trying to confuse you. It's more that we know that our partners and our on the ground chambers know more about the folks in their neighborhood than we do, and we want you to come and tell us what works best for them. So, but the bottom line, we just want to advance those 4 policy areas for the population that Amelia and I have described earlier. Eligibility and accountability. So kind of the technical, less fun stuff is that there are certain flow down requirements that come because this is CDC money, right? And federal money comes with certain rules. So we want to make sure that we're being really upfront about that. There are restricted costs. Those are research, clinical care. So unfortunately, no nurses going out and providing checkups to the little ones or anything like that. No furniture. Unfortunately, if you need new desks in your office, that's not what this grant is for. Reimbursement for pre-award costs. If you're already doing great work and you want to expand it, let's talk about expanding it. But the already doing part, that's not something you can apply for. Lobbying, that's kind of clear. Legislation, also kind of clear. Refreshments and childcare costs. So you'll recall childcare was a part of that earlier slide. We can talk about childcare policies, supporting folks that are caregivers, supporting connections, but we cannot pay for childcare. So I know that's just a differentiation. I just want to call out because it does seem like it might be conflicting. If you do receive $750,000 or more in annually in federal funds, it does require a separate audit. So be aware of that. And you want to be thinking, if I've received a bunch of other, federal grants, and then I get an extra $12,000, is that going to push me above? Do I already know I'm above that 750? And I hope you're doing that audit if you are. Attribution language on all materials. And the last corner, you'll see that attribution language. And Amelia talked about that as well. Just really important that folks understand where that funding is coming from. It also does require some media approval. If you are just going gangbusters and you're going to do a press conference because things are just going so well and you've got all these great community partners, we love that. We will need some advance notice. The county does have to approve that. Again, just making sure that everybody's got good transparency. And then alignment with Live Well San Diego vision. I think that most of us are already Live Well partners, and so we're well aware of what that vision is, but just a heads up. And then background check procedures, and then vetting of staff and volunteers through the federal databases, which are very easy. It's a monthly check. Type in the name, go, you're good. You do not need to be a chamber member or a chamber particularly. But we are looking for business organizations, local chambers, ethnic chambers, business supporting organizations. So looking at you guys, EDCs, bids, all of that sort of thing, right? So that's our primary focus, and we are prioritizing applications that can reflect partnership. There are a boatload of groups like us in town, and the more we can leverage one another's expertise, we believe the better we'll all be. Additionally, if you are chosen as a subcontractor, there is going to be a required monthly report. We'll provide you a template, so we're not trying to make you spend more time on paperwork than doing the good work. And bi-weekly meetings, earlier point, we're going to agree on that agenda in advance. So we're moving through it, and we're doing the good work, and we're just doing what we have to do on the administrative side to make sure everyone's in line. And then for any external events, let's say you're going to do an expo, we'd like heads up so that if we want to send somebody over, we can do that. Both regional chamber staff and the HHSA team, as well as payment. 50% you'll receive upon the completion of the contract, and then 50% upon finalization of work. Now, I understand that some of us are not able to float, right? That's some of that money that would be prohibitive. I don't want anyone to feel like the application should not be pursued because of that. So if it's determined that we need to turn a knob up or down on when payments received, please let us know and we can work through that as needed. It's most important that we're able to do the work. That administrative stuff we'll work on with you if it's determined that you just have this perfect program and great partners. Timeline. This stuff's kind of basic, right? RFPs 1 and 2. So there are 5 total. We're going to put 2 out May 1st. And again, any one of those 4 issue areas you're welcome to pick from. But we'll have 2 out for selection on May 23rd, by May 23rd. Preferably, we're going to have all of our ducks in a row. We're going to get there before so that we can get out in time. RFPs 3 and 4 will be out, I'm hoping, first week of July. So a post 4th of July celebratory paperwork release, selection in early August. RFP 5, the final one, will be out August 2022 and selection in September 2022. So maybe a back to school sort of timeline. Once we get that, once we finalize that contract, we hand it over to the county, and then we're ready to rock. It's those monthly meetings, it's the biweekly meetings and monthly templates. I'm sure there are a boatload of questions, but we are actually tracking perfectly on time. Yes, we're going to take questions at the tail end. So hold on to it, put it in the chat, put it on a post-it note. I'm going to hand it over to Spencer because now we're going to move into those 2 county programs that we're just putting up as an example, as a tool for you. Spencer's going to walk us through the acceleration program, which is actually very awesome. My team got the same briefing recently, and I'm going to hand it over to him, but very excited to work with you all.
Okay. Thanks so much, Stephanie. I'm going to share my screen now. Great. So today we're going to give a little bit of overview about Live Well at Work, as well as one of our flagship programs called the Healthy Workplace Accelerator program. And this is, we're sharing this with you today because this is an opportunity to help support employers in creating a culture of wellness. So the grant that Stephanie and Amelia talked about was a little bit more COVID focused. This is more about how are you supporting your employees on physical activity, nutrition, lactation, maternal health, all these different modalities of wellness. And we'll go over that more in some more detail. So as we talked about earlier, the Live Well San Diego vision is building better health, living safely, and thriving. At Live Well at Work, we help do this for employers and work sites. So we help employee populations build better health, living safely, and thriving. And this is really important because one, studies have shown that an evidence-based worksite wellness program can not only improve the health of the population, but also increase productivity, reduce healthcare costs, reduce employee absenteeism, and also great for employee morale and bonding as well. So, and in San Diego County, there's a lot of businesses. This is a big opportunity for us at the county to reach individuals, is through businesses. And as Stephanie mentioned, not all businesses have all the resources or the knowledge or the time to invest in employee wellness. And so the goal of this program is to make it accessible for work sites to implement an evidence-based worksite wellness program in a low-cost way, in a way that using policies, systems, environmental changes, all things that any worksite can do at a low or very reasonable cost, and it can have significant impacts on employee health and wellness. So I mentioned earlier, we help businesses create healthier workplaces. We've worked historically across all fields and industries, so we can work with any type of organization to support them in their wellness journey. Here's some examples of some of the work sites and businesses that we've worked with. And so our approach is very kind of big picture, high level. We look holistically at the entire wellness initiative, whereas other, vendors or suppliers of different wellness services may be very focused on just, a physical activity component or a nutrition. We really look at it integratively, holistically, to make sure that it's designed to be sustainable, to be evidence-based, to, what is your wellness committee? How's that structured? What type of communications channels do you use to communicate wellness opportunities to the employees? So it's very big picture. And we utilize an evidence-based assessment to help find where are the gaps in your wellness initiative. And based off that assessment, we provide an action plan and lots of resources and templates for policies and all sorts of different opportunities and things that you can use to implement these strategies. And I mentioned earlier, a lot of it's very policy-based, environmental-based, and systems-based. An example of an environmental change might be having a water cooler, right? Something very low cost, you put it in once and forever, their environments change. So they're cued, the employees are cued to fill up their water bottle. It becomes part of their daily routine. And so here's some of the campaigns that we've done in the past with businesses, and I'll go through them quickly because I want to get to the actual Accelerator program. But we've helped businesses create policies for healthy meetings and what that looks like in terms of the food and integrating physical activity into their meetings. Here's the template, stairwell promotion. So creating signs with little nudges to take the stairs rather than the elevator. Helping create walking paths around their facilities to encourage walking meetings or little walking breaks. We've done it at the county fair as well. Signage for the cafeteria, for education around healthy eating. And these are all signage that we're actually available to provide to any business for free. We have these signage that we can provide. So that's another opportunity. Hydration stations, lactation accommodation, lactation rooms. Perfect. So now I'm going to get into the Healthy Workplace Accelerator program, and it's one of our flagship programs at Live Well at Work. And so if you look on the right, it's a 5-step cyclical process. First step being register, and then you score, get recognized, take action, and collaborate. So I'll explain more about what this means because we'll actually do a live demo of the Accelerator program. And basically the history of the Accelerator program was Live Well at Work used to do in-person, on-site technical assistance. One of our staff would go to a work site and assess their work hand in hand with their HR or manager, whoever's responsible for employee wellness. And together we'd assess their work site and come up with an action plan. And it was very in-person, hands-on. And we thought, what if there was a way to digitize this process, right? What if we used technology to make this program a little bit available for more work sites, right? Because there's so many hours in the day. So that's what this program is. It's an online version of this assistance that we used to provide. So it's very self-directed. And of course, our team is here at any point in the journey to support your worksite in the process. But it's an online self-directed program that's designed for management, for work sites. A lot of employee wellness providers or vendors, the services are employee facing. We support management and HR in developing these programs. And so the benefits of participating: lower healthcare costs, increased employee morale. Our program, since it's self-directed, it's also very at your own pace. So some organizations may be through a busy time, some may have more time. So it's very customizable based off of their needs. It works for small, medium, and large businesses. It works well for businesses that have an existing program, as well as organizations that are just getting started in the process. So it's very helpful kind of wherever you are in your wellness journey. So now I'm going to actually pull up the online tool for everyone and show you actually what this looks like. Great. So here is the dashboard. There's 4 steps of the program. The first step being score. So this is a evidence-based tool to basically a questionnaire about your worksite wellness policies and programs. And this is adapted from the CDC Worksite Health Scorecard. So it's evidence-based, it's from the CDC, and it's been developed over the past 10 years with lots of partnering organizations that have developed this. Based off of the assessment, you will then, the worksite will then get awarded a badge. This is an actual decal that you can place at your worksite or online on social media to showcase with your community and your partners and your customers that your organization values wellness and is making an active effort to improve employee wellness. Third step is the action plan. So based off of the assessment and where the gaps are, we'll actually provide a customized action plan with evidence-based strategies, with resources to help implement the program. And then the fourth is collaboration. So something that we heard from a lot of our work sites was that they felt alone in the process. It can be a big task to change a culture of wellness, to adopt new policies, to get people excited and on board. So collaboration is, we have meetings once a month where we have different speakers and discuss challenges and opportunities amongst different work sites and best practices. So if we go into score, just to show you what this looks like, and I'm going to go really quick just because we only have a few minutes left, is here's the assessment. It's split into 3 different sections. You basically click get started to take each one. And it'll, once you take the assessment, then it'll pre-populate all of the data throughout this program. So, I'm gonna do a little quick change here for some sample data. And as you can see, this sample worksite, you can see their score. You can see where the gaps are in their program across all these different areas of wellness. So this worksite is, has an opportunity to improve in maternal health and tobacco, alcohol and substance abuse, and organizational supports, but they're doing really well when it comes to nutrition. We can also track the worksite wellness program longitudinally over time. So the idea is that every 6 months, a worksite will have the opportunity to retake their assessment. And you can track your progress over time. We also want to recognize all the existing efforts and programs available. So all of these are what an organization is already doing well in. These are clickable, and I'll explain how that works in a second. Here's the badge that I mentioned earlier. So there's 4 different levels of badges: learner, innovator, leader, and accelerator, based off of their overall score in the program. And here we have the action plan. So at a worksite, these are all the suggested strategies based off the assessment. The worksite would then choose which one they would want to focus on. And you can then click on them, and it takes you to the action plan page, where it tells you what it is, why it matters, a step-by-step process for implementing that strategy, sample policies, sample resources, etc. And you can also use this as a task management tool. So you can put in a task owner, start date, due date, and kind of check off as they progress through the various strategies. And lastly, collaborate. So these are some of the different opportunities we have for collaboration: our monthly calls, joining the COVID-19 business sector newsletter, submitting a blog of a success story of something they've done, what a worksite has done well, as well as different resources in the community. Think about it as like a preferred provider list of wellness services. So that is the Accelerator program. It looks like we are my 15 minutes is just about up. So I will hand it back over to Stephanie, but
you can take an extra 5 if you'd like.
I think that's just about done. I think I'm good. So this is something we're really excited about getting out there. So we would love your help in sharing this program.
Good morning. Thank you for calling Assemblymember Dr. Teal Ever's office. This is Moana. Who do
So we'd really appreciate either your organization to join the Accelerator program. It's completely free. Or if you support other organizations or know others that might be interested, please send them our way. We're really excited about getting this program out there. And if you, we'll put a link I'll put a link in the chat if you want to sign up, as well as my email address if you want to meet to talk about it or learn more. So we're really excited about sharing this and look forward to getting this out there and helping more businesses. So thank you. That's it for me, Stephanie. And we'll be taking questions at the end, right?
Yep.
Awesome.
Thank you so much, Spencer. What I love about that program is how they thought. I mean, yes, we all want there to be all the materials available in all the translated languages, but I like that they thought about the next steps, right? So a business is interested, and then there's sample policies, and then there's programs, and then So it follows them all the way through, which is great. So they can take it at their own pace. But next up, we're going to hear from Victor Ruiz talk about what OES has at the county. And again, these are just examples of the tools that the county has available that we can use with our subcontractors to plug into the community. So ready-made stuff, which is great. Victor, are you here with us? I thought I saw. There we go. Okay, I'm going to go ahead and mute and hand it over to you.
Okay, thank you very much, Stephanie, and hi everyone. My name is Victor Ruiz. I have also here with me my coworker Marilena Castellanos. She's the liaison from the Office of Emergency Services. We're going to do a brief presentation on what Partner Relay is, what Partner Relay is doing, and also how can you support the program or use the program as well. So give me one quick second to, okay, it says host has disabled participant screen sharing.
You should be good to go. We just made you a co-host.
Perfect. Thank you so much. Okay, just to confirm, can you see my screen?
Yep.
Perfect. Okay. Okay, well, first of all, the Partner Relay in general is related to emergency preparedness and public health response. This is for agencies that are serving multicultural, immigrant, and refugee communities. Like I mentioned, Marilena Castellanos is our liaison from the Office of Emergency Services. My name is Victor Ruiz. I'm a health promotion specialist for the County of San Diego under Public Health Services. I've been working on this program for almost 4 months. So what is Partner Relay? Partner Relay, in a nutshell, is an initiative. It's an initiative to improve communication with limited English proficient populations that are called as LEP. And this is during natural disasters and public health emergencies. These efforts are coordinated by the Office of Border Health and Public Health Services, where I'm at, and the Office of Emergency Services. Now, it is comprised of individuals that represent trusted partner organizations that are currently serving immigrant and refugee communities throughout the San Diego County, throughout the 6 HHSA regions. And the Partner Relay members, they serve as bridges to the communities that do not often receive life-saving information, again, due to language and other access barriers. And our partners have agreed to share vetted county incident information. And this can be either during an emergency activation or just providing preventive information to the communities. Again, this is related to natural disasters and public health emergencies. This is a brief overview of the Partner Relay communication process. In this case, being specific to the Office of Emergency Services, where we receive the updated and vetted information and messaging from the OES. And then from there, the Partner Relay, we share that information with our partners, and our partners disseminate it through their communication networks, and this can be via social media, this can be via phone trees, whatever communication platform they use with their communities, with the intention of their community members receiving the critical public health information in a culturally and appropriate manner. Now, I have to mention, though, that previously the Partner Relay was relying on the Partner Relay partners to conduct the translation and the dissemination of messages, which is exciting that nowadays more languages and translation services are being incorporated into the county, and the intention is transitioning out of that model, right, of relying on nonprofit organizations to do the work of translating and disseminating. Excuse me? Heard an oh?
I think
Okay.
you're good.
Okay. Yeah. And in this case, right now, it's an exciting time for the program itself, because now we can reach out to other internal stakeholders from the county and start using these services and resources to disseminate information throughout throughout the county. And what we're currently doing, we're developing a community presence. We're revamping the program, restructuring it, and we're conducting community presentations related to natural disasters and public health emergencies. And we're in the process of integrating new partners, pretty much designing other ways to reach limited English proficiency populations. And how can we better serve our communities? And again, this is a very short presentation. We can, if you're interested in having a deeper conversation about the partner relay, I'll share my contact information. But it's interesting because as it was mentioned before by Amelia, we are currently falling under the CDC grant, the Sounder Strategy 4. And our scopes of work overlap in many areas. So I'm very excited to have further conversations with the other stakeholders that are working under this strategy. Now I'm going to pass it over to Maria Elena Castellanos to share some of the information that we are currently providing out to the community members in San Diego.
Thank you, Victor, and good morning to everybody. My name is Maria Elena Castellanos, here with the Office of Emergency Services, and I'm just going to mention a few points. The big goal for our department, of course, is to create a culture of resilience in San Diego County. There's a lot of room to grow and to help prepare residents as well as small businesses. Just a fact that I wanted to throw out there for anyone who maybe was not aware, but here in San Diego, as many of you know, we have a very large population, over 3 million people, but only 1% of San Diego County's local fire and law enforcement, emergency medical first responders make up 1% of the total population. So I mention this point because in the event of a major emergency or a major natural disaster, it would take time for first responders to maybe get to, a small business. If depending how large the disaster is, it could take a while. And so that's why the county has us, because it really can make a difference when individuals know what to do in the event of an emergency, a natural disaster. So the county does have a number of materials that are available, a number of resources, and I'm only just going to mention a very small few today. I don't know, Victor, if you want to go to the next slide. Thank you. So very quickly, we do have these personal disaster plans. These are available. You can get a copy if you request one from us, but they're also available online to be downloaded digitally. And they are translated into a number of languages, and we are exploring and in the process of translating them into more languages. So we will have them available soon, hopefully. I won't really go into everything that's in here, but there's a lot of really good information that can help a business or residents. The next slide. And San Diego County is very lucky. The county actually created an app for residents to have. Would help a small business as well. And it's a communication, obviously, is the key, being informed, knowing what's happening. And it is available on the county's website, readysandiego.org, and it's free. And it's a really great resource. There's a lot to talk about there, but I'm just mentioning it briefly. The next slide. And as you know, here in San Diego, we could potentially experience a large earthquake. Not every city has this technology, but here in San Diego, through that app, we do have the Shake Ready technology, which would help provide, it does help provide information about an earthquake. And so that is another potential natural disaster that we could face, and it's also on the application. I could talk more about that, but we'll keep it short for the time that we have. And the next slide. And finally, I just want to mention, if you want to learn more about the resources that we have, you can learn through the website that I mentioned. It's readysandiego.org. And like Victor said, we are happy to provide presentations and trainings to any of the groups that you're associated with via a small business or any of the other groups. We really do want to see San Diego County residents and businesses be ready for when something happens. And that's all. Thank you.
Thank you, Mariana. Yeah, and we do have a link for SurveyMonkey if you want to join the partner relay. However, like I mentioned before, if you like to have a one-on-one meeting, talk more in detail about what the partner relay is doing, some ideas that you have on how can we collaborate with you, with your business, and in general with your community members, how can we better serve them? My suggestion would be to send an email directly to me and Maria Elena, and we're more than happy to meet with you. And that's everything that we have from our end. Thank you so much.
Great, thank you. Appreciate all of the questions. So now we're going to go ahead and we can open it up to questions that are about any of those programs. You can ask specific questions about my presentation or about the larger CDC grant. I know that we did have Ernesta, I believe, asked when the RFP responses would be due, which is a very good question. And thank you for asking that. They'll be due 2 weeks after they go live. So May 1st will be our first one. That will be due May 15th or whatever business day. Let me double check. So it'll be May 16th. We'll expect those due. Are there other specific, there was more questions about in the chat kind of about language support. So the five subcontracts that I outlined, we're not going to be requesting translation services. However, if you looked on that list and a population that you directly serve wasn't listed there, and in addition to the work you're going to be doing, perhaps connecting people to partner relay through a variety of presentations and helping engage your service populations, you're going to be supporting that with language services. That makes sense. But when it comes to just pure translation subcontracts, you won't see that from our side. I'm just scrolling down. Okay, I see a lot of good contact information. When we send out the PowerPoints to the full list, we'll also include questions and answers. So if you missed anything, don't worry. And we'll also have this recording available. Are there other questions? You can raise your hand. You can just unmute. We're not very formal. Everybody's just excited to return to their Friday to-do list, maybe.
Go
ahead. Yeah.
That the 3 rounds are identical. So if you miss the first round, plan on the second and the third rounds having the identical criteria, identical amounts. Don't stress out. So if you miss the May 16th deadline, that is why these are, it's not exactly rolling, but that's why there's 3 rounds.
Yes, thank you. And there will be additional opportunities later down the line where we'll be doing innovative projects. And so that's, even broader than these, where we learn in 4 months that, wow, we didn't even consider that the business community was going to need this thing that we didn't even know we were going to deal with, right? Who knows where we are in the booster discussion or in something like that. And so if that's the case, and you all have developed a really wonderful responsive program, that's where those innovation opportunities are going to be. And kudos to the county for designing it that way, because we all know that we don't know what we don't know, right? And so giving space to that is really excellent. And I'm sure you guys are going to say that's all well and good, Stephanie, but when does that happen? Let me pick that up for you, and I'll tell you right now. But we will do another one of these for when we are approaching that date, which is in year 2. So that's what that's telling me. That's towards the end of 2022. Yes, Tana. And Tana, thank you for the really good questions. Really appreciate you kind of jumping in there. So Q4 of 2022 is when you'll start seeing those innovative projects hit the mark, and we'll make sure to do an industry day with plenty of lead time for you, because I know that once everybody's kids go back to school and the holidays hit, time flies, right?
Can I answer?
Uh-huh.
I wanted to just verbally answer Tana's question about language translation. So not language translation per se, but absolutely providing training, community events, developing materials in language is allowable as long as you make that connection to one of the 4 focus areas in the RFP. So just wanted to, yes. Yes,
So
Tana.
along
Good to see you.
So along those lines and not recreating the wheel, if we have the ability to translate some of the existing materials that the county has that are in other languages, but not in our languages, you know, I mean, just kind of saving, because we'll do our own process of translating and back translating the existing materials. But I just appreciate that opportunity to be able to do that, because, you know, our communities are kind of the underserved within the underserved. So I just really appreciate this space. Thank you.
Thank you. And Alejandra, you were up next with your hand raised. Hi.
Hi, how are you? I just had a question about I guess in the notes it says it has to be for the entire county, but you also said that you encourage like regional organizations specific to a location to apply. So I'm kind of confused on that. Can you?
Great question. So let's say that East County Chamber of Commerce applies, but East County Chamber obviously serves one specific area. The thing that we would need to see in their response is that they have a plan to address an equally distributed portion of the county. So we can't focus in one specific section. And if you look at the Healthy Places Index or opportunity zones, where most of the businesses that we're referencing and those communities are anyway, that's really where we want to focus. It's not that somebody could say, well, I'm just going to do this in downtown, the end. But if you don't have capacity to expand past, let's use our East County Chamber again, then they could partner with, you know, North County and IRC, and together they have the capacity, the staff, the resources to reach out to a more equitably distributed representation of the county. Does that make more sense?
Yes. So for example, if we were to apply for Otay Mesa, we obviously have a 99% Hispanic Latino community. We would have to partner with the rest of other geographical organizations to cover the entire county?
No, you wouldn't. You certainly don't have to if your plan is to do virtual outreach, and so you don't necessarily need somebody on the ground in North County, for instance, and you would instead be able to invite and reach out to those people, then that would be fine.
But you have to target the entire county.
Yes. We don't want any one piece of the county to benefit from all of this work. So that's the gist there. But Amelia's ready to jump in. Amelia?
So one way to think of this is that the CDC is really looking at people and populations that are disproportionately impacted by COVID. They may be concentrated in certain communities, but the point is looking at the people. So we don't want you to just have a boundary and say, this is my physical boundary, because we want to look at populations impacted. So that is also the reason why there's multiple subcontracts being put out, because we also want to make sure that the whole county is served. If your target population, if your partners tend to congregate in a certain community, that's not a negative thing. That's a great thing, but just be accessible to those populations who may, for instance, if it's a Hispanic Latino, yes, they may be congregated in Otay Mesa, but they're also in other places. Pacific Islanders may be concentrated in one community, but they're also in other parts of the community. So that's, I don't know, we just wanted to make sure that it's about the populations and not about if a geographic area. Does that make sense?
It makes sense, but it doesn't help. I mean, I think it's actually a detractor for like organizations like us to engage, because we already have a community engagement with a certain community, and you're asking us to, when we do have partnerships all around the county, but it's not a community we know, so it involves a lot more. So I mean, so I understand what you're saying. I'm just sort of sharing, it just might not be for us.
So Alejandra, we will definitely take that question back to our team. And then when we put out the responses, we will clarify with the team further about that question. And thank you for sharing that challenge.
That's very helpful. Yeah. And I'm so glad the county is here to help us work through this. There was one more question, and I want to get to that before we go back to Tana. Moana asked about the timeline for translation with the county, which is a good one. So Amelia or Ches, I'm not sure who would answer this, but what is the turnaround for the translation services when we are submitting things to be translated? Have we locked in on a time for that? Is it a few weeks?
Let's see, Chess is not unmuting. It's basically a new contract that we have. So we have not yet tested that out with an influx of translation requests. So I think the earlier the better. There's maybe an expectation of 1 to 2 weeks turnaround time.
Great.
But Chess, did you want to clarify?
Sorry. Hi, everyone. Yeah, Ches Blevins. I'm with the Amelia's team. And yeah, we don't, as Amelia said, this is a brand new contract for us. So we haven't started it yet. So the first couple of requests may take a little bit longer, but once everything is kind of established and routine, yes, absolutely. We would expect a very quick turnaround time to be responsive to community needs. But our partners, you folks that are going to be engaged in this work, will have to sort of factor that into your timetables in terms of allowing adequate time. So just on the safe side, think of 2 to 4 weeks initially, but as things become more routine, we would hope to get it within a week to 10 days.
Thank you, Chess. And Tana, you had another question?
Yeah, thank you. It's a safe space because I'm asking questions, so I appreciate that. And plus, I'm familiar with Amelia. She's a champion in our community, so thank you. Just wanted to chime in with regards to the previous comment, and I appreciate, but there's also the flip side, whereas communities like Pacific Islanders, who are smaller and often lost in the radar of data disaggregation, and even just with the county's reporting, we've been 1 or 2 in deaths and cases. Although they also say that we're 99% vaccinated, which is false. So we're also advocating for not only data disaggregation, but also clean data collection. But in that note, our communities have always kind of been under-sourced, under-resourced, and underserved. But we've been able to operate in that arena of, because we're not congregated in like a certain city, or, so we're dispersed throughout the county. And we've been very lucky to, through our cultural networks, be able to serve our communities in that sense. So I appreciate CDC, because a lot of times things are place-based, and then that's where we become even more invisible. But when you make it population-based, it gives us more of a fighting chance to be visible. And so we appreciate that, there's that kind of at least perspective that gives some of the smaller and most often invisible communities an opportunity to be a part of this. So thank you.
It's great to hear everybody's perspective. At the very least, I think that we can all learn a lot from each other. And to that point, I'll say that there will also be CEO roundtables, which, as we continue to learn, in retrospect, that name we probably should have revisited, but these roundtables of best practices and getting everybody involved. So I'm very hopeful that you'll engage frequently with the chamber and the HHSA team with whatever you have going on, and we can share that information amongst each other. For some of you, it's the first time that I've seen you from my seat at the regional chamber, and that both makes me sad that it's taken me so long to get introduced to you, but I'm so excited Dana, so excited to meet you. So excited to get to work with you and see how we can support the incredible work you're doing inside the formal grant and the contract and outside of that as well. So this should be the beginning of a lot of partnerships. So if you don't know the people on the participant list, this is a great time to like ping them and say, can we talk about what it is that you do? Okay, any other questions there? No, and all this stuff will go out, like I said, via email on Monday. And so if you have any questions, just because it's going to take a while to get the video uploaded, I don't know why that is, but it's slow.
Hey,
Amelia?
There was a question.
Oh,
There was a
sorry.
question about approval time, and since Chess is on the line, we have a formal approval process with the county, and so I just wanted to ask Chess, as far as press releases, public-facing documents, can you help share the process for the subcontracts to go through public-facing approval for public-facing documents?
Yes, sure. The thing is, whenever there's kind of stuff that we're promoting that's being branded with this grant information, HHSA, you know,
Oh, I think we lost Jess. Okay.
Seems like that's possible. While we wait for him to kind of figure that out, there's another question. Any plans for military spouses or moms? They were also disproportionately affected during the pandemic and also have high depression rates. That is true. That would qualify. I think, Amelia, you tell me if this is different, but that does qualify as folks that who are traditionally kind of outside the scope of folks that we serve. Again, this is through the business resiliency piece, so we would want to be careful that we're connecting that through there. I don't see why not, but we don't call them out specifically. If you do a Control F and try to find that population listed anywhere in our documents, you probably won't find them.
But I would say that, you know, out of the full CDC grant, there would be opportunity to serve different populations. So I'm putting my email in the chat box. I may have done it earlier, but definitely contact me and we can look at how to reach some of these unique populations.
And Chess is back. You want to finish your thought now?
Sure. So anything that requires attribution language or logo use and it's public facing for promotion or education purposes, you know, we do have to put it through a review process. You know, we try to expedite that, but that is also about a 10 to 14-day process. So you just need to factor that into the timetable. And just for important, if there's other things like, say, I don't know, media. Let's say one of the local media outlets contacts and they want an interview and they want it today, you know, just an FYI on that is fine. But whenever, you know, it's planned, intentional materials that you're going to put out for promotional or educational purposes, then we just need to have a chance to review it before it goes out.
Good distinction. So if that cut off for anybody, if it's planned, if it's intentional, if you're scheduling something, we have to get approval. If it's something that just happens on the fly and you're doing such a good job that media wants to talk to you about it, then go forth, but make sure you give the county an FYI. And I see that we've got somebody off mute.
Oh, it's me. My camera is weird. I'm looking off into space, but I'm looking at you. Sorry, I just noticed that. I used to work for some county funded, the ATOD grants, Minnesota Community Coalition work. And whenever we did a press release, I'm very good at press because I used to be a reporter. So if a panda wasn't being born at the zoo, we would have media coverage. That was the joke, right? So I'm pretty good at that. We have no pandas now. So we have, you know, we have a chance here too. So if we get the funding and we get media, we used to have, I think it was like we'd have to have this particular language at the bottom of all our releases. It's been a few years, I can't remember, but we're a this, of a that, of a thing, of a this, of a that, and then all the logos. Amelia, you're nodding your head. Yeah, I know. It was an
Still applies.
Yes. Okay. So I'll probably try to dig up one of my old press releases from
Just,
my coworkers.
just to be aware that because this is CDC funding, there's going to be language coming from CDC.
Yeah. And I worked at the national level too for their coalition of coalitions. So under a CDC tobacco many years too. So I remember it was kind of this call if you haven't done that. It does work, but you have to be a little patient. So yeah.
Okay, so and some of you have experience with county contracts and grants, being a grant recipient. So apply all of that previous knowledge to walking into this. This is no different, right? But I guess, you know, we're all learning together with regard to COVID. Nobody had a cheat sheet on that one when it hit us, did we? So we are coming up to that 11:15 mark. Like I said, everybody, we will be sending all of this out via email. I appreciate your time. I'm pleased to meet you. Thank you to the county team. Amelia, any final comments?
Just wanted to appreciate everyone for taking the time to come, giving this program a chance. You know, we're trying to be as innovative as possible. We know that the county contracting process is cumbersome, and we're very excited for this partnership with the San Diego Regional Chamber of Commerce and being able to support the community. So please give us a chance, you know, put your great ideas on paper, and we're looking forward to seeing what dreams you have to support your communities.
Thank you, everybody. We're going to go ahead and stop recording.